Williamson, West Virginia. It used to be the hub of the billion-dollar coal field. Like most small towns, unfortunately, it has seen some collapse through the years for different reasons. Unfortunately, we're known here for some negative health metrics. We're one of the leaders in cardiovascular disease, one of the leaders in diabetic rates, adult obesity rates. Life expectancy here is about 12 years shorter than the national average. The patient to provider ratio here is extremely low. Geographically speaking, we're disadvantaged, so our access to care has already got a few uphill battles, if you will. You know, Southern West Virginia, Appalachia as a whole, it's in my opinion, the most beautiful place in the whole country. We just have like this hub of nature and recreation, and this real sense of family here ties the community together. And I think that's just such an important thing, such a beautiful thing. And that's why I love the community that I'm from.
Cameron Johnson I've known since he was a little kid. Cameron and my oldest son are really good friends. They played ball together. Used to coach ball with his dad, so I've watched Cam be a little knucklehead to grow into a great young man that's all about helping and making a change in his community. I watched Cam create and build programs. He's seen that people needed something, and he created an opportunity for people, and he realized that's where his heart was.
Cameron came to me to see if we can collaborate together with my gentle yoga class to do a CPR training with my group there. He is a jack of all trades. Everybody really enjoyed his company, and he was just amazing.
Like Cameron was bonding with people from the get-go. He was willing to talk to people that sometimes I could not reach.
My previous work experience was actually in a cardiac catheterization lab, so I kind of worked on the clinical side of healthcare. I wanted to venture out of that work, and that's how I wound up with the American Heart Association. And I found that, you know, healthcare can look a little bit different, right? So we can serve our communities in different ways. So as a community connector, I'm able to bridge the gap where there are lapses in access to care in this small community. Meeting people in the spaces they're already coming to, I'm able to impact them in their day-to-day life where they don't maybe want to go see a doctor, or they're unable to see a doctor. You know, they're able to come to us and maybe have that BP check, and we're able to raise their attention to, hey, you have a problem with your blood pressure. Let's refer you to a provider that can really help you get on track.
Rural at Heart started out as a workforce program called Heart Core. We have limited staff at the American Heart Association that don't necessarily represent every community across the country. So Heart Core was a way to find people from those communities, to serve those communities and really give back in the most meaningful way.
The biggest disparities or gaps in our health system are transportation, because there's no public transportation, and this is a really rural area. Education, like a lot of people just don't understand, you know, if they are diagnosed with something, or how to get checked, or even what to do. In our county, there's one grocery store, a brick and mortar grocery store, and from where I'm sitting right now, it's an hour away.
It's hard to tell somebody how to eat healthy if they have no food. But Cameron was the actual push to get the food pantry open and get that going, and it couldn't have came at a more crucial time, because it was the month that people did not get their SNAP in November. And we had completed paperwork like first week of October. And it was like, hit the ground running, here's some money, go stock up your food pantry. That is a critical need for us.
I really think of this nice lady that I met. She was a part of our Food as Medicine program. She also was a regular participant in our SMBP program. For her, she was a single woman. She was widowed 20 years previous. She didn't have a strong support group, anything like that. So not only was she able to get blood pressure education, referrals to resources that really impacted her health, but she was able to build community. Not only did her health metrics improve, but her overall demeanor improved. Her attitude, her personality, she started to shine again. And I really loved being able to help someone make that change in their life.
Cam sparked something in me. It was inspirational. Then I was like, if this young guy can do it, you know, that used to be a little knucklehead I seen playing in the sand, then I need to step up and do my part.
We make people feel like they matter. And if they feel like they matter, they come back to their appointments. they will come back and do their follow-up. They'll come back and do their blood work, and they will put more effort usually into their health than what they might have if they just felt like a patient.
It not only is providing a different ability for us to meet communities where they truly are, but it's changing people's lives like Cameron.
If Rural at Heart had more feet on the ground, if we had more community connectors in communities across the country, I feel like this work is just so important to small communities. The access to care, nationwide could be expanded, and I feel like our health outcomes as a country could be improved through work just like this.